July 5th, 2016, Tuesday. Now it's best to examine the female cat people sensation, take temperature. Now this one is 39.5, it's just between the upper limit of normal. And then of course you check the mucous membrane, which is okay. And then also capillary refill time, less than 1 second. Gums are pale, he's 6-month-old. And overall, use the stethoscope to check the heart and lungs. So in case of any pneumonia or not, although normally they don't vaccinate the cat. Check both sides. Check the heart rate. So temperature is okay. Then heart and lungs. Okay, then after that we check the abdominal palpation. Palpate the abdomen for any lumps or any swelling or pain. So palpate the abdomen. Palpate, unless the cat is very unhappy, it's not unhappy. Palpate abdomen. So that is the standard. And then the pulse, respiratory rate and pulse. Take respiratory rate upon observation and do the pulse. check the pulse rate, pulse pressure, volume. Okay, then done. Then respiratory rate, but just observation of the chest movement is less than 40 per minute. This is what you can see. So for a cat which is, this is a 6-month-old coming in for spaying, these are the things to be done before going straight into the injection of the tranquilizer, sedation. Now 2.5 kg, and this one is xylazine plus ketamine combined IM, and normally I find it sufficient for spaying, provided the vet is fast enough and spay the cat within 15 minutes. That means the whole process of injection to end of spay should be 15 minutes injection, then wait about 5 minutes, spay 10 minutes, which should be more than enough, and that's it. This, if not, then you have to top up with isoflurane ketamine. Now this dosage has been used by me for over the years. Now the xylazine ketamine combination, 1 syringe IM is xylazine 20 at 0.1 plus ketamine 0.4 in 1 syringe IM for cats less than 3 kg, about 1 to 3, and cats more than 3 to 5, 3 to 6, then there is a 0.2 ketamine plus 0.8 0.2 xylazine plus 0.8 ketamine IM, making it to 1 ml. There is more for the 5 kg to 6 kg cats for spay. For neutering, you can reduce it by 50% or by 30%. Each vet has its own formula, and reversing may be needed if you use more xylazine. In this case, in the other practice is they use the formula is xylazine 0.1 ml per kg plus ketamine is 0.1 ml per kg minus the volume used for xylazine. So for example, 5 kg cat, so they were based on xylazine 0.5 ml plus ketamine is 0.4 ml IM. In this case, I noticed the xylazine is quite high at 0.5, whereas for me it probably will be at 0.2 because my formula will be 0.2 xylazine plus 0.8 ketamine. So their ketamine is lower. So in this case, they use reversing to reverse it, and it's quite effective. Okay, now we will proceed with this cat for spay at 0.15 ml xylazine by 0.4 ml. Ketamine, what we do is bring the cage up first. Bring the cage up first so that once we inject, the cat will run into the carrier without having to struggle too much. The assistant holds the neck, scruff the neck, and get ready. Okay.